Welcome to the Political Bridge. I am Ada, your host. Today we confront a massive shift in American public health and national security. Recent data reveals that fentanyl deaths plunged by 22% nationwide. This drop sparks an intense debate over what actually caused it. One side credits aggressive border enforcement, wall construction, and strict drug interdiction under President Trump. The other side points to massive investments in public health, community-based harm reduction, and expanded access to overdose reversal drugs funded during previous years. We will test both claims with hard data and examine what this trend means for working families and communities across the country. Let us examine the numbers, strip away the talking points, and see which strategy holds up to close scrutiny. Nico, you have the floor first. Make your case for why border enforcement drove this historic drop in fatalities.
Thank you, Ada. Fentanyl deaths are down 22%, and that success traces directly to our southern border. When the government secures the border, dangerous drugs stop flowing into our neighborhoods. Under President Trump, law enforcement officials have seized record amounts of fentanyl before it crosses into towns and cities. Think about a mother in Ohio or a warehouse worker in Arizona. They face fewer poison pills in their communities because border agents intercept shipments at ports of entry. For years, critics called strict enforcement impossible. Now the data proves them wrong. When you stop illegal crossings and target cartel supply chains, lives get saved. Public health programs treat the symptoms after the poison arrives. Enforcement stops the poison at the source. This is why aggressive border enforcement remains the most effective tool we have. The numbers show that deterrence works, and our national security strategy is delivering real results for working families across America today.
Thank you, Ada. A 22% drop in deaths is wonderful news, but crediting walls ignores the reality on the ground. This progress belongs to public health workers, community clinics, and expanded access to naloxone, which is a life-saving medicine that reverses opioid overdoses instantly. Think about a teacher in a rural town who carries nasal spray to save a student whose life hangs in the balance. That is harm reduction in action. Federal funding distributed over the last several years put millions of treatment doses directly into the hands of local health departments. Cartels simply shift their smuggling methods to legal ports of entry, meaning walls do not stop the chemical precursors. Real safety comes from treating addiction as a health crisis, not just a criminal problem. When we invest in treatment centers and mental health support, people survive. Border enforcement alone cannot solve a public health emergency. We must look at the data showing that community health funding drives this vital progress forward.
Thank you both. Nico credits supply-side interdiction at the border, while Jordan attributes the drop to demand-side health measures like naloxone. Now let us press deeper into the mechanics of these competing claims. Nico, in your next turn, address how interdiction accounts for shifts in cartel smuggling tactics through legal ports of entry. Jordan, prepare to defend how community health funding outpaces the sheer volume of illicit supply entering the country. The debate starts now.
Jordan claims public health funding drove this drop, but that argument ignores how illicit fentanyl actually moves. Most of this synthetic poison enters through legal ports of entry hidden inside commercial trucks, not just backpacks in the desert. When border agents use advanced scanning technology at those ports, they catch cartels red-handed. That is a direct result of strict enforcement policies prioritizing border security. Claiming that community health programs caused a 22% drop misses the fundamental economic reality of supply and demand. If you flood the market with cheap drugs, treatment centers get overwhelmed and cannot keep pace. By cracking down on entry points, law enforcement chokes off the supply before it ever reaches local streets. Think about a trucker or a small business owner who wants safe communities. They rely on the rule of law to keep dangerous substances out of local commerce. Enforcement creates the stability that allows public health programs to actually succeed in our neighborhoods.
Nico leans heavily on interdiction, but his argument relies on a major blind spot regarding chemical precursors. Cartels do not need finished fentanyl to cross the border anymore. They ship raw precursor chemicals from overseas directly to labs, making supply-side crackdowns like playing whack-a-mole. The real reason deaths dropped by 22% is that millions of Americans now carry naloxone in their cars, backpacks, and purses. Think about a restaurant worker or a college student who reverses an overdose in a public restroom. That intervention happens in seconds, long before law enforcement can trace a cartel supply chain. Federal grants made these reversal kits widely available in bars, libraries, and community centers nationwide. When you saturate communities with life-saving medicine, people survive long enough to seek treatment. Public health infrastructure is the true engine behind this drop in fatalities. Focusing solely on walls and seizures ignores the direct evidence that harm reduction saves lives every single day across America.
We have reached the stress test round. Both of you face a serious challenge on your core assumptions. Nico, your weak point is that seizure data often reflects increased border activity rather than reduced total supply entering the illegal market. Jordan, your weak point is that while naloxone treats overdoses, it does nothing to stop the underlying addiction or prevent new users from starting. Defend these specific vulnerabilities. Nico, you go first.
Ada, your challenge misses the core reality of how law enforcement measures success against transnational cartels. Increased seizures do not just show busy agents. They represent tons of lethal fentanyl kept off American streets and out of our local schools. When you intercept massive shipments at the border, cartels lose billions of dollars in revenue, which directly disrupts their entire distribution network. Think about a parent sending their teenager to a community event. They do not care about abstract supply curves. They care that the pills are intercepted before reaching local dealers. Border enforcement creates a high barrier that forces criminal networks to retreat. Public health measures are vital for recovery, but they respond after the poison already circulates in our towns. We must stop the inflow first. Claiming that interdiction fails because cartels adapt is an argument for surrender. Strong borders and aggressive law enforcement remain the absolute bedrock of national safety, protecting families from lethal synthetic drugs every single day.
Ada, calling naloxone a temporary fix, ignores how recovery actually begins in the real world. You cannot treat an addiction if the person does not survive their first overdose. Naloxone keeps people alive so they can enter treatment programs, find stable housing, and rebuild their lives with dignity. Think about a father who gets a second chance at life because a bystander carried nasal spray. That single intervention opens the door to long-term recovery and community healing. Public health investments also fund medication-assisted treatment, which cuts down relapse rates significantly across working-class neighborhoods. Relying strictly on border walls fails because chemical precursors easily bypass physical barriers through postal mail and commercial freight. We need a strategy rooted in medical science and social support, not failed prohibition models from the past. The 22% drop in deaths proves that keeping people alive through widespread harm reduction gives treatment a fighting chance to succeed nationwide.
The core clash is clear. Nico insists that stopping the drug at the border is the only way to protect American communities, while Jordan argues that keeping people alive through public health measures drives the drop in deaths. Neither side concedes ground on what truly solved this crisis.
The data tells a very clear story about accountability and national security. When we prioritize border enforcement, we choke off the supply of deadly fentanyl at its entry points. Think about a police officer or a local mayor trying to keep their town safe from criminal cartels. They need a federal government that secures the border and backs up the rule of law. Public health programs play a supporting role in recovery, but they cannot replace the foundational necessity of stopping illegal drugs from entering our country in the first place. The 22% drop in fatalities shows that deterrence works when leaders commit to it fully. We must maintain strong border policies, support our law enforcement agencies, and protect American families from synthetic drug trafficking. This is the most practical path forward to ensure long-term safety and security for every neighborhood across the United States.
Saving lives requires looking past political talking points and following the medical evidence. The drop in fentanyl deaths proves that community-based care and widespread access to naloxone are working. Think about a nurse in an emergency room or a social worker in a rural county. They see firsthand how harm reduction saves lives when traditional enforcement methods fall short. Cartels will always find new ways to smuggle chemicals, making walls a temporary illusion of safety rather than a real solution. True security comes from investing in people, expanding mental health services, and treating addiction as a public health crisis that demands empathy and resources. We must double down on the health strategies that brought these numbers down. By supporting our communities with real medical care, we build a safer, fairer future for every family across this nation. Let us commit to the solutions that heal our communities from the inside out.
That concludes our debate on border enforcement versus public health strategies in the fight against fentanyl. Find The Political Bridge on Spotify or Apple Podcasts. Join us next time for another engaging discussion. Until then, stay informed, stay engaged, and keep the debate alive.